Well, look, there are many benefits of early discharge, but the first one is more when you have a growing TAVI program, it's clear there are some constraints. It's not typically so much in the cath lab itself, but it's because you have a limited hospitalization capacity. So if you get these patients rather early after their TAVI procedure out of the hospital, you can get the new patients in. So you take that bottleneck away. That's one thing. Secondly, it gives a reduction of costs because shorter length of stay, shorter costs, of course. And then thirdly, I would say it smooths up the whole patient pathway through for his treatment within intra-hospital. So that's a benefit for the hospital, but also for sure for the patient. I think it works best if you kind of try to offer this to almost your whole TAVI population. Of course, there are some differences. You have these very frail patients, then you have to think of where can this patient go to, but still you should almost try to implement this on all your patients, and then maybe next day, not discharge home, but then for these very frail patients, next day to the referring hospital or to a nursing home or some intermediate care center. But you should almost try to implement it on all your TAVI patients. Yeah, so how to get to next day discharge? Many people want to do it, but they have the question like how to get there. Well, it's also been a learning process for us for many years. I think it works the best as follows, that it's a real teamwork. You need a real good TAVI nurse specialist or a TAVI coordinator. I would prefer to call it TAVI nurse specialist. They are key role. I don't play a key role in it. It's mostly their task. What they do is already you have to prepare it pre-procedurally. You have to do a good case planning, good mix of cases per day. You have to align the expectations of the patients. That's very important. If patients come into the hospital with the expectation he will be hospitalized for 3-4 days, you cannot go suddenly the day after to the patient and say, look, it actually went all really good, you can go home. These elderly patients are not mentally prepared or practically prepared for this. So you have to prepare these things up front. Then you also have to do, of course, a nice minimalistic TAVI procedure without complications. That's our task as an operator, but we do that with the current techniques, we can obtain this. And then, of course, afterwards, I think it's very important that you have a kind of a standardized post-TAVI care in the hospital. You do almost the same for everybody. You mobilize them early. You look for the decision for pacemaker, yes or no, the day after. You don't keep them unnecessary several days hospitalized into your hospital. You make that decision the next day. And then what is also really important when you discharge them the next day, that you inform these patients very well what to do if something happens, like what if there is a small oozing in my groin, what if I feel maybe dizziness. You have to, so the patient feels safe when he goes home, he feels well instructed, well informed, and you have to give some tapered recommendations to your patients. For example, your very frail patients, you don't just see them back after 30 days. You maybe offer them to see them the week after in the ambulatory already. So you can that shouldn't be too standardized. There you can do a patient-tailored approach for the post-discharge follow-up. But in that hospital, what happens there, you should standardize it as much as possible. It's all about independence. I mean, and these younger patients, they are more independent. So you can get them easier, faster discharged after TAVI. Yeah. There are a couple of typically site-specific reports on this. I think the most important message is, and that's the most important also as a conclusion, is that it's feasible and it's safe. There are maybe some reports that says even that these patients with negative discharge, they have a better outcome. I would think we have to be careful with that. It's probably a patient selection bias because it's typically these better and less frail patients you get also discharged the next day. But anyway, I don't think that's the most important. If you can prove it's safe and feasible, that's the most important. It's all about aligning expectations. If a patient comes in and he expects to be hospitalized for 3-4 days, he will not be happy even to go home, to be forced to go home, then he feels like the next day in an elderly patient. But if you prepare them pre-procedurally, even with a TAVI nurse specialist, they can look to the needs of these patients up front and they can look, okay, you're an 80-year-old living alone, maybe you will need a little bit of help for your food, for your cleaning, for maybe if they're really in a bigger need, they have diabetes or other diseases that maybe they have a contact with their GP. So they look into these patient-specific needs. So you have to do that, pre-procedural, plan it, and then align the expectations of the patient, and then the patients are very happy to get that opportunity to get next day discharge.